Welcome to the pre-surgical class for spine surgery. We are honored that you have chosen Advent Health on your journey. Before we begin, please take a moment to pause, grab a pen and paper, and write down any questions you may have. Currently, Advent Health has 4 team members across Volusia and Lake counties who are here to help you on your spine surgery journey. Please refer any questions or concerns you have to the navigator associated with the hospital you will be having your spine surgery at. Contact information will be provided at the end of the presentation. Here's a list of our current neurosurgical and orthopedic spine surgeons working in Advent Health hospitals across Volusia and Lake counties. Dr. Akturi, Dr. Barnum, Dr. Elfalal, Dr. Lavoie, Dr. Jimenez, Dr. Velat, and Dr. Venus. Our goal is to assist you in understanding using a multidisciplinary approach on what will be happening during every phase of your spine surgery. Today, we will go over pre-surgery planning, preparing your home, nutritional considerations, what to expect the day before surgery, the day of surgery, and the day after surgery, therapy services, discharge planning, knowing what your zone tools are, how they help, and frequently asked questions. Please write down any questions you may have during this presentation. You can contact your orthopedic or spine navigator with any questions or concerns. CREATION is an acronym we use at Advent Health. Creation Life is the whole person health philosophy embraced by Advent Health to help individuals achieve maximum health and wellness. Our goal is to positively influence all aspects of your life, including mind, body, and spirit. The C stands for choice, the R for rest, the E for environment, A for activity, T for trust, I for interpersonal relationships, O for outlook, and N for nutrition. Coaches play an important role in your recovery. Coaches can be a spouse, family member, close friend, or neighbor. Someone who can stay with you or someone you can stay with immediately after you return home from the hospital. Coaches build your confidence, provide much needed support, and ensure a safer and faster recovery with improved results. The role of the coach includes providing motivation, taking care of pets, providing or arranging your meals, monitoring your medications, and providing much needed emotional support during your recovery. Now let's talk about preparing for surgery. Your physician may order specific tests to clear you for your upcoming surgery. You will be instructed by the office on when and where to go to have this completed. Prior, you will speak with a pre-admissions nurse to discuss medications, past medical history, and they will provide specific instructions related to your surgery. This can be done in person or by phone. Expect a call from either the office or the hospital about what time you are expected to arrive the day of surgery. It is recommended that you stop smoking before and continue to not smoke after your surgery. Smoking may increase your risk for infection and affect how well your body heals. TobaccoFreeFlorida.com is a great resource to help you quit, offering free counseling as well as services. For patients with unique living situations, please let the office know so steps can be made to accommodate a safe recovery. Examples of this include living on the 3rd floor of an apartment building without elevator access, living home alone, living in an RV, or if you have no bed or furniture within your household. Prior to surgery, please have a discussion with your surgeon if you are taking any medications. Be specific regarding any herbals, supplements, or non-prescription medications. Some medications, even non-prescription, may have unknown side effects or affect medications that you may receive while in the hospital. If you are taking a blood thinning medication, your prescribing physician will instruct you on when to stop taking it. They should also discuss when it is safe to resume medications. Examples of prescribed blood thinners include warfarin, Plavix, Eliquis, and Xarelto. Some patients need to take narcotic pain medications every day to help relieve chronic pain. If you are one of these patients, please let your surgeon know. If you see a pain specialist, speak with that provider about your upcoming surgery as well. Examples of narcotic pain medications include morphine, Dilaudid, oxycodone, Percocet, hydrocodone, roxicodone, tramadol, among several others. Here are a few items you may want to purchase prior to surgery. The use of stool softeners is highly recommended prior to surgery. Docusate sodium, also known as Colace, can be very helpful and it is not a laxative. A bottle of plain Tylenol, 325 milligram tablets, not PM, arthritis, or extra strength. It's important to note that you should not take more than 4,000 milligrams of Tylenol in a 24-hour period. Also, you may be prescribed a narcotic medication that contains Tylenol or acetaminophen within it. Before your surgery, some other important reminders. Please make sure to bring a copy of your medication list that includes any supplements, liquids, or elixirs. Please include your dosage, frequency, and the name of the medication. Question. Medications that need to be stopped prior to surgery include A. Vitamins, B. Blood thinners, C. Herbal supplements, or D. All of the above. D. All of the above. Now let's talk about preparing your home. It is important to make modifications to your home prior to your surgery. This will decrease your risk of falls or injury. Here are some tips to prepare your home for when you're discharged from the hospital. Remove all clutter. Clean and put laundry away. Place clean linens on your bed. Arrange your closets. Prepare meals. Any yard maintenance that may be needed. Picking up loose rugs on the floor. Electrical cords out of the way. Adequate lighting within the home, and pet care. Now let's talk about room precautions. Stairways. Check to make sure the handrails are stable. Check to make sure all of the lights are functioning in stairways, entryways, and hallways. Please let a therapist know if you have stairs at home, as they will practice stairs and provide safety education prior to going home. Bedrooms. Make sure there's a clear path between the bed and the bathroom. Have a phone and lamp within reach for easy access. Always sit while dressing to prevent falling. It is important to have adequate lighting, such as night lights or automatic sensors, to help prevent falls. Bathrooms. You may want to install handrails in your bathroom and shower for additional safety, avoiding suction cups. Skid-resistant strips or mats are helpful in preventing slips and falls in the showers or tubs. Your therapist may suggest a 3-in-1 commode as both an over-the-toilet seat riser and a walk-in shower chair. Kitchen. Prior to surgery, pay attention to movements that may require bending, lifting, or twisting in your everyday life, and prepare your home environment for a safe return, as some of these movements may be restricted after your surgery. Plan by storing frequently used items in the kitchen at waist level, and less frequently used items in higher or lower cabinets. It is also helpful to prepare and freeze meals prior to coming to the hospital. Question. What simple changes can you make to your home prior to surgery that will decrease your risk of falls? Checking for secure handrails, clearing the path between bed and bathroom, removing throw rugs to avoid tripping, preparing meals, or all of the above? All of the above. Now let's talk about nutrition. It is important for you to start preparing now. Be sure to eat a well-balanced diet and drink plenty of fluids. If possible, consider taking a multivitamin daily. It is recommended to take stool softeners before surgery as we prepare our body for the healing process after surgery. It is normal to have a decreased appetite after your surgery. Eat a small amount of protein at each snack and meal. This helps with wound healing, keeps your immune system strong, and promotes bone building. Aim for 2 to 3 servings a day of protein-rich foods such as eggs, meat, fish, yogurt, dairy, peanut butter, beans, and nuts. Healthy nutrition is very important before and after surgery. Your doctor will determine the appropriate diet for you after discharge based on your medical history. Some nutritional considerations include calcium, vitamin D, iron, fiber, vitamin C, zinc, and water. Adequate hydration will prevent constipation as well as promote healing. Unless your physician is restricting the amount of fluids you drink, the focus should be on drinking 6 to 8 glasses of water a day. You can find more information on healthy nutrition at www.choosemyplate.gov. Let's talk about the night before surgery. The night before surgery, unless otherwise instructed, you will not be allowed to eat or drink after midnight. Your pre-admissions nurse will instruct you on which medications, if any, to take the morning of surgery. After surgery, we will resume your diet slowly as anesthesia wears off. Some patients feel nauseous during this process. You will have medications ordered for nausea if you should require it. Your diet will start with clear liquids and advance per your surgeon's recommendations based on your past medical history and other pertinent factors. Enhanced recovery after surgery. Your facility may provide carbohydrate drinks for the day before and morning of surgery. Your pre-admissions nurse will guide you on this process. If this is discussed, please follow the instructions closely. If not, please refer to the previous slide for nothing by mouth after midnight the night before your procedure. Depending on your surgery, you may go home the same day, while others may need to stay overnight. This will be determined by your surgeon prior to surgery. You may want to pack an overnight bag in the event that you must stay overnight in the hospital. Consider placing your bag in the car the evening before surgery. Remember to pack charging cords for any electronics you may have. Some items to include are loose-fitting clothes, sweater, walking shoes with rubber soles, hearing aids, glasses, dentures, CPAP machines, or anything the surgeon may have given you in the office. Also, bring a list of your medications, your insurance cards, and a photo ID. Please avoid bringing any valuables with you to the hospital. In the days before surgery, you want to check for wounds on your skin. If you notice you have any wounds, new redness or swelling, please notify your surgeon's office. Do not shave your arms or legs within 48 hours of surgery, as this helps to decrease the risk of infection. You will be instructed when to begin using a chlorhexidine prep or CHG prep to bathe prior to surgery. It is important to keep it away from your eyes and perineal areas. Report any reactions to your surgeon. Do not use lotions or powders after you begin use of the chlorhexidine prep. It is important to sleep on clean bed linens and in clean pajamas before and after your hospital stay. Hygiene. Pre-operative showers help to reduce bacteria on your skin. Clean clothes also reduce our risk of infection. Hand hygiene is very important. Soap and water is the most effective way. However, if water is not easily available, the use of hand sanitizer will work if your hands are not visibly soiled. Artificial nails hold on to bacteria. Please consider removing them to reduce your risk of infection. Question: true or false? I should bring valuables with me the day of surgery. False. Now let's talk about the day of surgery. Pre-surgery area. Please arrive on time to the preoperative area. Be sure to check in when you arrive. Anesthesia will see you in the preoperative area to discuss their plan with you. Please remember to discuss any previous history of nausea and vomiting after surgery, as well as any reactions you may have experienced from previous procedures. Your surgeon will also see you in the preoperative area to mark the surgical site and answer any last-minute questions. After surgery, you will be moved to the recovery area. Your surgeon will update any family or friends as requested when your surgery is over. Visitation the day of surgery. Families, friends, and coaches on the day of surgery are encouraged for support. Recovery can take 1 to 2 hours immediately post-op, and your visitors will be notified when they can visit you. Please note, visiting hours vary by campus. Your coach is encouraged to be present at the hospital on post-op day 1, after surgery, and day of discharge to hear discharge instructions with you. Let's talk about after surgery. After surgery, what to expect. The following devices or equipment may be seen after your surgery. Your surgeon may request that you wear a neck collar or back brace. This should be discussed prior to surgery, or if indicated, after the surgery before your therapy begins. Sequential compression devices, also known as SCDs, promote blood flow to your lower extremities while you are resting in bed. This reduces your risk of blood clots. Dressing practices vary among our surgeons. You may find a dressing in place after your procedure. Our team will help you understand how to care for the dressing and the incision. If a drain is in place, our team will help you understand its purpose and when to expect it to be removed. Drains promote extra drainage from the surgical site and promote incision health. Some procedures require a urinary catheter to be in place. Once the surgery is complete, this will be removed. Urinary catheters increase your risk of urinary tract infection, so we want to remove them as quickly and safely as possible once the procedure is over. Bladder and bowel continence is also an important assessment tool for your team. IV medications may continue after the surgery as your diet is advanced. Once you are safe to eat and drink again, many of these medications can be progressed to pill form. Your team may also recommend the use of assistive devices such as a walker, cane, crutches, or many others as you heal. Walking after surgery is an important process for recovery. Our goal is to have you up out of bed or to a chair within 4 to 6 hours after your procedure. While this seems like a short amount of time, be assured there will be several team members to assist you. Your safety is our #1 concern. Early ambulation is proven to reduce recovery time and reduce post-surgical complications. Ambulation is helpful to manage pain, decrease risk of post-op complications, expedite removal of urinary catheters, and removal of additional equipment. Your diet will be advanced as you wake up. Your nurse will check for bowel sounds and your ability to swallow to safely advance your diet. The advancement in your diet will sound something like this. First, clear liquids consisting of jello, broth, and water, then to full liquids consisting of oatmeal and soups, and then to your regular diet. Physical therapy. This will begin the day of surgery or the day after. You will be encouraged to eat meals in the chair and walk to the restroom. A nurse or therapist should instruct you on how to do exercises in the bed or while sitting in the chair. Provider visits and rounding. A physician, physician's assistant, or nurse practitioner will round on you daily to check on your progress. You will also receive a visit from a case manager. Case management's role is to assist you with the discharge process. You should also receive a visit from the nurse manager or the assistant nurse manager for the floor to see how your care is going. Incentive spirometry. You may be given a device that's called an incentive spirometer. You will also use this to prevent respiratory complications. Again, your nurse or respiratory therapist will instruct you on this process. Your physician may order lab work the day after surgery. You will also get vital signs taken per your unit's protocol, and this is typically taken every 4 to 8 hours. Other things to note as a reminder: no smoking, vaping, or nicotine patches. If you have concerns for any of these items, please notify your nursing team so they can assist you. Question: you will be expected to ambulate within how many hours after surgery? 5, 4 to 6, 7, or 8 hours? 4 to 6 hours. Pain after surgery is expected. This is how we measure your pain with a pain scale. Establish a realistic pain score prior to your surgery to use as a goal. On this pain scale, 0 indicates no pain at all, whereas 10 indicates the worst pain possible. Please understand that a pain goal of 0 is unrealistic after surgery. A realistic pain goal should allow you to talk, walk, deep breathe, and participate in physical therapy. Communication is key to pain control. Nurses should round on you hourly and ask you about your pain scale from 0 to 10. It is important to keep your pain under control. Please do not wait until your pain is at a level of 10 before asking for medications. We use a multimodal approach consisting of non-narcotic pain medications, cold therapy, repositioning, and elevation to decrease pain and swelling. Here are some additional comfort measures that you may take into consideration as you heal from your surgery. Position changes, walking, prayer, meditation, art therapy, pet therapy, music, and aromatherapy. Question: I will have no pain after surgery because the pain medications work so well. False. What is therapy? Our goal today is to give you a picture of what to expect from a rehab perspective after surgery. Physical therapy is going to help you improve strength, balance, range of motion, transfers, and walking. Occupational therapy will help you work on things that you use on a daily basis like bathing, dressing, and toileting, grooming, and other self-care activities. To maximize your surgery and recovery, it is important to participate in all therapy sessions. Our goal and expectation is for you to sit up in a chair for every meal. Physical therapy will be asking about your home environment and any physical challenges you may have. What to expect with physical therapy. We want you to resume normal function as soon and as safely as possible while maintaining precautions to protect the surgery. Getting out of bed, walking, sitting, and exercises are considered medicine and is meant to promote healing. Research supports that therapy within 24 hours of surgery decreases post-op complications and length of stay in the hospital. Post-op pain is decreased with an increase in mobility following surgery. What to expect. Therapy will likely begin within 24 hours after surgery, but you are expected to ambulate within 4 to 6 hours after your procedure. This will be done with your therapist or registered nurse. In the first session, the physical therapist will ask some questions, get you up out of bed, into a chair, and walking if possible. They may recommend any assistive devices you may need. Your case manager will help to arrange any necessary equipment. As you progress, your surgeon will direct you to the setting that best suits your needs with the goal of going home. Post-op exercises. You will work with your physical therapist on exercises and activities that are appropriate for you post-surgery. Your physical therapist will also discuss any physical restrictions you may have, such as no bending, no lifting, and no twisting. They will also show you how to get in and out of bed while maintaining proper body alignment using the log roll technique. One of the most important exercises are ankle pumps. This exercise will help promote blood flow, preventing blood clots. We would like you to perform ankle pumps every hour. Let's talk about discharge planning. Dispatch Health. Our goal is to safely transition you from the hospital to your home. Advent Health has partnered with Dispatch Health. Dispatch Health offers affordable, same-day medical care in your home for urgent but non-life-threatening issues. To request care, call 407-986-9373 or visit dispatchhealth.com. Dispatch Health is available 8 a.m. through 10 p.m., 7 days a week, including holidays. Know your zone. Now let's discuss zone tools. First is the green zone. Your symptoms are under control if your incision is clean, pain is controlled, you have regular bowel movements, you are able to increase activity, and you have no shortness of breath, chest pain, or fever. Next is the yellow zone. The following yellow zone symptoms warrant a call to your surgeon's office or spine coordinator. If you have increased swelling or pain since the surgery, fevers that are greater than 101 degrees Fahrenheit, increased drainage or redness at the incision, calf tenderness, swelling or warmth in either leg, or new numbness, tingling, or weakness. The last is the red zone. The following red zone symptoms warrant a trip to the emergency room. If you have loss of bowel or bladder control, severe shortness of breath, chest pain, sudden confusion or trouble speaking, numbness in your face, arm, or legs, sudden severe headaches, or sudden vision changes. If this happens, please call 911. Do not drive yourself to the emergency department. Surgical site infections. What is a surgical site infection? A surgical site infection is an infection in the part of the body where the surgery took place. What are common signs and symptoms? You will see redness, swelling, warmth around the incision, yellowish or greenish bloody discharge, a foul smell coming from the incision site opens, or fever. If you experience any of these symptoms, call your surgeon for follow-up. How do we avoid a surgical site infection? Pre- and post-operative antibiotic administration, making sure we have clean hands, CHG baths prior to surgery, using clean linens, and dressing changes as ordered. Preventing surgical site infections. Prevention is key. Here's what you can do. Tell your doctor about any other medical problems you may have. Remove acrylic nails and fingernail polish. Quit smoking. Do not shave areas near the surgery location. The use of our HIPAA or our CHG soaps the night before and morning of surgery to cleanse skin of all bacteria as directed by your surgeon. And of course, always wash your hands. What should I do when I go home? Preventing a surgical site infection at home. Understand how to care for your wound. Wash your hands before and after care for your wound. Have visitors clean their hands. No water submersion, including hot tubs, pools, bathtubs, or beach. Once cleared to do so, you may take a daily shower. Ensure you have clean linens and clean clothes. Do not allow pets to sleep with you until your incision is healed. And if any symptoms, please call your doctor immediately. Question: if I'm having severe shortness of breath and/or chest pain, I should call 911. True. Question: what can you do to reduce your risk of a surgical site infection? Wash your hands, use CHG soap before surgery, remove fingernail polish and/or artificial nails, once cleared to do so, daily showers, or all of the above. All of the above. Frequently asked questions. When can I shower? Showers vary by procedure and surgeon. Your medical team should provide this information with you before leaving the hospital. When can I drive? You should not drive until cleared by your physician. How will my pain be managed? Pain is managed using a multimodal approach using medications, ice, repositioning, and gentle exercise. How long will I be in the hospital? You may discharge same day or stay 1 to 2 nights. Your surgeon will let you know the expected time frames. When can I get out of bed? Early ambulation decreases complications. You should expect to be up and out of bed within 4 to 6 hours after your surgery. Thank you for taking time to watch this video as you plan for your upcoming surgery. On this screen, you will find each campus has a coordinator that will assist you in answering any additional questions should you have them. We look forward to seeing you soon.